When I think back on it, before I was diagnosed, how simple my life was. In a way, I was working, I was enjoying myself in the great outdoors. I was doing a lot of skiing and outdoor activity, enjoying my friends. And then came the diagnosis. Hello, my name is Karen. I live in North Carolina, and I was diagnosed with multiple myeloma 3.5 years ago. And obviously it came as quite a shock to me. I didn't know anything about multiple myeloma yet, but I realized I just had to focus and get all the facts and learn everything going forward that I could about this disease. I began my treatment program the following week after I was diagnosed, which was going to be a stem cell transplant. That was quite a procedure. I won't be shy about that. I was very anxious. There were a lot of steps. I spent almost 4 weeks in the hospital post-transplant. It's a hard treatment. It's a difficult treatment. I had 3 years in remission, and I said that was a pretty good gift. Being told that I was going to relapse, it's something you think about all the time. You're always thinking about it because you know the day is going to come, But then you say, well, maybe I'll be lucky, maybe I'll just keep going for a while. When I found out that I had relapsed, I knew it would come, but you're sitting there and you're listening to all of it, and it was pretty shocking and it was pretty scary. So I said to myself, well, we're gonna move on to the next way that I can get another remission. I did feel sad about it, don't get me wrong. I had to absorb it. Because of the fact that this is a disease of relapse, it is extremely important that patients have choices in the different treatment options for their multiple myeloma. I would have to say that you have to become an advocate for yourself. You need to overall know your choices, the basic things about your disease, and you need to learn it. In addition to just doing the treatment, though, I'm having lab work done every single week. So I'm constantly thinking every week now about my lab work, about my treatments, and it's brought me a little bit more anxiety to my life. My husband has been an incredible support system. We do all the major doctor visits together. He understands my multiple myeloma as well as I do. Sometimes I think better.
My name is Joe, and I've been married to Karen for 19 years now. I think to be an effective care partner, you need to first educate yourself, because a good understanding of the disease, the treatments, the modalities, all these things will help you make decisions for your spouse or whoever you're engaged with there. Karen's been very good about being her own advocate. She does need help. Certainly there's accompanying her to medical appointments and these kinds of things. Occasionally being emotionally supportive, but she's done a great job of that on her own.
I think it's extremely important to have someone with you so that you're both there and you're both hearing the same thing. And many times it becomes so overwhelming with the information that you're given. I've had treatments and I had a lot of changes in my life, but I still managed to be positive and to enjoy my life as best that I could with my new treatment program. You have to find other things besides the multiple myeloma that can bring positive things into your life. Yes, we do have multiple myeloma, but your life can't be just about that. You have to have some other avenues, some other things that bring you joy. My goal now is to just go forward and live each and every day to the fullest. You can still live your life and still enjoy going places, things that are important to you.